afternoon, good evening, good morning, depending on where you are watching me from. Today we have come again to talk about a very important topic, a topic that concerns men, but it concerns women also. It's a topic that is interesting, that touches the foundation of most families, and it's a topic that makes a man cry tears of sorrow. Now, this topic is something that has to do with the male organ and how it works. And we have to talk about it, the erectile dysfunction. Erectile dysfunction, that's the medical term for it. Some people call it impotence and whatever. But the medical term for it is erectile dysfunction. Now, it affects mostly men from 40 years and above, and also it can affect young men depending on whether they are sick or not. Now, what does it involve? It involves inability of a man to have an erection and sustain erection that will lead to a successful sexual activity. Now, in most cases, a man may have erection, the erection may collapse on the line, or he may not have erection at all. There are factors that cause this problem. I have to deal with the factors that cause this problem in this video, so that in the next video I'll talk about what to do to solve this problem. Now, what are the causes? One of the major causes is that old age causes reduction in the male hormone, the testosterone. So the hormonal problem can be the major cause. Once the hormones, the testosterone is going down, the activities of the male organ becomes lowered. Now, in a case of hormonal problem, if the hormones, the testosterone is low, even when you are younger, it's not enough to sustain what activity a man does. That means the person may have erectile dysfunction due to hormonal problem. So the testosterone is a hormone that is responsible for what activity a man does as a man. So if the hormone is low, most of the times the person may have erectile dysfunction, may have loss of interest in sex, may have loss of libido, may have even inability to have orgasm. So some of these things are hormonal. That the next factor or the next cause of this problem is a neurological problem. Neurology, in the sense that neurology means the nerves that take sensation from the body back to the brain. So this if a nerve is having problem, the nerve is having problem in the male organ. This can lead to erectile dysfunction because that's what lead to the erection in the first place. Then another thing that can cause problem is if it is a person is having vascular problem. Vascular problem as the arteries or the veins are having problems. In this case, the blood supply to the male organ is reduced or compromised, and in that case, the person may have erectile dysfunction. So you see that the blood supply to the male organ is very important in the issues of erection. Another factor that may cause this problem is a factor of, we call it psychogenic factors. Now, these are factors that have to do with the psychology of the person. It has to do with the mental health of the person. If the person is mentally ill or is having psychological problems like depression and the rest of them, the person may likely develop a kind of erectile dysfunction. Then another factor that may cause this is the drugs. Some people are on medications. Most of these medications may affect the erectile function of a man. So in most cases, the drugs can cause erectile dysfunction if care is not taken. So we have drugs that cause it. Then another factor that may cause it surgery. If a person have undergone surgery, especially in the pelvic region, like somebody that underwent a prostatectomy, that is where the prostate operation or cancer operations in the body, that person may develop this issue of erectile dysfunction. So these are the major headings upon which all the other ones come. Now, if we start breaking it down, we can have people that are having chronic illnesses like diabetes, hypertension, cancer, and all kinds of chronic illnesses. Most of the times, the nerves are affected, and the person may develop this problem of erectile dysfunction. Another issue is the issue of people that have this issue of infection. You know, when some people have infection and it's not sexually transmitted diseases and they are not properly treated, they may affect the nerves or affect the veins or whatever, the arteries, and in the process, the person may develop erectile dysfunction. Other factors may include obesity. When a person's body mass index is more than 25, the chances of having erectile dysfunction is high. And then diet, the diet you take, if you are basing our diet on carbohydrates more, we may have an issue of erectile dysfunction because there may be deposition of fat, excess fat around the waist area, and in that case, the person may have erectile dysfunction. So, and also, if a person is not doing exercise as the body needs, there may be erectile dysfunction. So these are the many factors. There are so many others that are responsible for this erectile dysfunction. So it's not a problem that is something that you can just overlook. And many people don't go to hospital, and we have under diagnosis of diseases. A lot of people have this problem, and they are hiding it, and they are managing it in their homes. Go to the hospital and find out what is a problem, so that we can get a solution to it. I think in the in the next video, I will do justice to the treatment and the what you are supposed to do if you have such a problem. I still remain Dr. Solution, and I say it always and I repeat it. The more knowledge you have about your health, the healthier you live. Thank you.